The next area that we're going to cover today is called personality disorders. Again, a common part from which MCQs are asked in the entrance. What is personality? It is basically who are you? You are a big part of you is your personality. People remember your personality. One question that people often ask is why do people react differently to the same given situation? It's because of their personality. The word persona actually quite literally means in Latin to wear different masks, and that is why I've shown different masks. Now, personality are the unique patterns of thinking, thought, feeling, and behavior which make each of us so different. And yet, if each of us being different, still we can be kind of put together in certain areas where there is overlap, where there is likelihood that we are very similar, and these are called personality traits. When is something called a trait, when is something called a disorder? It's a trait because we normally have all of it. All of us have some part of traits, but it is called a disorder when the personality patterns are pervasive, when they are inflexible, very important, and maladaptive. These are three important words, can be asked in MCQ in different formats. That what do you mean by personality disorders? Personality disorders are when they're pervasive all the time in all the settings, not changing despite the plea of other people around you. And finally, when they're maladaptive, they're not helpful for you. So you are saying I'm a very punctual person, but it's not helpful to people around you and to you anymore, then it is maladaptive as well. Children have emerging personality disorders, except for you cannot diagnose children with antisocial personality disorder. You can diagnose children with conduct disorder before 18, and after 18 you can diagnose with personality disorder called antisocial personality disorder if they meet the criteria for conduct. However, as a child, in your teenage also, through certain psychometric testing, for example, MACI, that is MACI, which is Millen's Adolescent Clinical Inventory, you can find traits of emerging borderline personality, emerging narcissism, emerging dependent personality, and so on, other personalities that we'll talk about. Let's talk about the various clusters. There are three main clusters, A, B, and C. We'll talk about each cluster. We'll talk about the mnemonic for each and every personality disorder so that it's easy to remember and that you can solve any question on earth around that. First is cluster A. Cluster A, the category is called odd and eccentric. There are peculiar thought processes and the affect is inappropriate. What is affect? It is the facial expression. So even I'm saying I'm very happy, instead of saying I'm very happy, now that is my affect. So cluster A is called the odd and eccentric, and the three under this are schizotypal, paranoid, and schizoid personality. Schizotypal and schizoid are often confusing. We'll clarify. First, let's talk about schizotypal. Schizotypal are essentially people who are eccentric. They have odd beliefs and thinking, and they may even not like to talk with other people because they have social anxiety and eccentricities in their thoughts and behavior. This is a nice fun mnemonic called UFO aider. Think of them as alien for a moment, and the alien is related to UFO, and they are aiding the UFO to come to planet Earth. That's how you can remember schizotypal. Now, schizotypal personality is UFO aider, meaning unusual perceptions. They're talking about things which are not even happening. They may border on even hallucination for some of them. They may be friendless except for family, and they may constantly have these odd beliefs that, one fine day God will come back on earth and then save us all, that kind of thing. They may have odd speech also. You can pick it out in a crowd when they talk very differently. And this is pervasive, constant. This is not a put on show. And this is not schizophrenia. It's not like just for a few days. And the effect is very inappropriate or constricted. The way I showed you, I'm very happy. I don't know what I feel. And they have ideas of reference. They think that everybody is referring to them, that, oh, that person was looking at me, that person was talking about me, because of which they also start avoiding other people. There's a constant doubt. So the paranoia kicks in from the point that there's not paranoid personality. There's a difference. Try to understand that. The idea of reference is, oh, other people are looking at me, they're talking about me, so let me be suspicious about them, let me keep a distance from them. And as a result, they come across as eccentric. They'll wear things which everybody else is wearing Indian clothes, but they are probably wearing their swimming clothes and saying chalo swimming chalte hain. So they do eccentric things, and they are very reluctant in social situations. They are essentially people who come across as loners and don't want to leave home, very happy being homebody, and have absolutely secluded themselves out. Again, it's a personality disorder. Let's take schizoid immediately so that we can see the contrast. Schizoid are people who have emotional detachment, have limited interest in relationships, and they have a preference for solitude. Now, the loner word is used here because, in the way that they say, I'm fine, I'm happy being by myself. No, I don't need too many friends. So it's not that they can't make friends, it's just that I don't need too many friends. And they essentially prefer the solitary part. It's not that they're incapable. Okay, now interestingly, the schizoid folks, the mnemonic is search safe, the S is for solitary lifestyle. They are the deeply introverted people that you may think. Again, introversion, extroversion is a spectrum, but here they may come across as deeply introverted. They're very indifferent. If you talk to them, don't talk to them. They don't feel upset. They don't feel much. They have no interest in relationship. They don't want to have a partner with their loved ones, immediate loved ones. Also, they have a very normal relationship, not out of the way. The sexual experiences are not something that they even vie for or look for, and they don't enjoy activities generally, and lack friends, and they come across as emotionally cold. Now, how is this different than schizotypal? These folks don't come across as ordinocentric, and they're not very fixated in their thought process. They can make friends, and also they're not bordering on the ideas of reference or thinking that other people don't like me. They're okay with the fact that I don't like to be with other people. So that is the biggest difference if you think about in schizotypal and personality and schizoid. We'll take some examples to elaborate as well. Paranoid personality disorder is very obvious in the name itself, that there is a lot of paranoia, a constant sense of people are out to get me, people are constantly criticizing me. Some may even say they're jealous of me, don't think they're narcissist. We'll come to what narcissism is, but they're saying, nobody likes me. Or nobody actually thinks everybody's criticizing me. That's the idea that they always say, and they're suspicious. What if that person is just talking to me because they want to get something from me? And it's a constant, not just with one person. So the idea of the mnemonic is get fact. They have no fact for supporting their suspicion, but they keep on saying get fact. They hold grudges for long period. They'll say, that one day you didn't talk to me, and I don't want to talk to you. I'm sure anyway you're behind my life or my property. And they keep on thinking that their exploitation privy, as in they're so vulnerable that somebody will exploit them. They keep telling their children, don't make friends, don't bring friends home, don't tell people where you live, don't tell people how we have gone for a vacation. They're constantly even questioning the fidelity of their partner. They're thinking, is my partner cheating on me? Can also turn into delusion of infidelity for some of them. There are often attacks on characters which they perceive. They say, that person didn't wish me properly. They don't think I'm important. How dare they mistreat me? They feel mistreated a lot. And they confide barely in another person. That's the C. And the T is threatening meaning read into normal events. So if somebody told them to sit close to the fan, they will think, that person wanted me to get hurt by the fan, which is why they made me sit next to the fan. Now, cluster B is a different, absolutely the opposite of what we were talking so far in cluster A. Here we find mood lability. Lability means up and down, so the mood swings. Amnesia, kind of forgetting with the idea that not remembering facts most of the time, and preoccupation with rejection. This is very hallmark. Fear of abandonment is very hallmark. This entire cluster is constantly talking and forgetting things that really matter, and then keeping on holding on things. So they're unpredictable, they're dramatic, they're intensely emotional. I like to remember the 4 personalities in cluster B as NABH, the board accreditation for the labs, which is narcissistic, N, A, antisocial, B, borderline, H for the histrionic personality. Let's take them up one by one. The narcissistic personality disorder, we've all heard the term of narcissist. It's based on this mythological character who is in love with his own reflection. There's exaggerated self-importance. I'm important. I'm the best. Nobody else knows that. And nobody else knows better than me. And there's a lack of empathy. Very important. Now, how does that show? They constantly feel that I did this because that person did that, and no, that person's emotions are not as important as mine. And there's a sense of entitlement. I need to be treated in a certain way. They would hate waiting in lines. They would tell the waiter, "Do you know who I am?" They would tell people that, I know XYZ person. They're always talking about their contacts. So the mnemonic is very interesting. A fame game. They're always talking about being famous. They want to be associated with famous people also. So a fame game. A is admiration. Oh, constantly needing admiration. F is the fantasizing about the unlimited success, that I have excess of everything. The A is arrogant. They come across as arrogant to people around them. They can manipulate others. Again, this is conscious subconscious conflict there. They're envious of others. How dare that person actually get the promotion, whereas I deserved it. There's a grandiosity and constant sense of importance. I'm the best. I should have gotten it. The boss should have trusted me. He doesn't know better. I know better than the boss. They associate it only with special people. Oh, how can I be friends with you? I actually am friends with the XYZ politician, and I don't think I have time to be friends with other people. There's a me first attitude, always prioritizing self, and a lacking empathy with others. So it's a fame game. That's the mnemonic. Let's talk about the antisocial personality. What's interesting is there's a slight overlap. Sometimes we can have ASPD or antisocial personality disorder with narcissism. Also, you'll find some features similar. And if you remember, we said that children cannot be diagnosed with antisocial personality. They're diagnosed with conduct disorder in the childhood. And in adulthood, they can be diagnosed with antisocial personality. In a nutshell, people who come across as deceitful, crooks, people who are in the jail are essentially labeled as folks who have antisocial personality disorder. They tendency to have a disregard for others. They lack empathy. They're impulsive, and they repeat unlawful actions again and again. Now, what does this look like? The callous man, the word callous, to show that, this is how they are. The conduct disorder has to be there before the age of 15, which means that they may have hit small birds, they may have threatened people, they may have tried to be sexually close to someone despite their consent, they steal, they lie, they manipulate. So a lot of those factors have been there in conduct disorder before 15. The current age should be at least 18. They have done antisocial acts and have led to tryst with the law. This could be drug peddling, this could be robbing, this could be forgery, this could be cheating, this could be getting somebody to have a sexual encounter with them forcefully. So all of those make up for the antisocial acts. They often lie. They're very clever liars. They don't feel remorse, very important. There's a lack of superego. The superego tells you to be guilty and remorseful, but they lack a superego. And the obligations that they say, hey, I'll meet you there at 5 p.m., they don't honor it. I'll give your money back to you. They don't honor it. They're unstable, they can't plan ahead. And the safety of others around them is also affected, and they ignore it. And finally, they often have money problems. Their children and spouses don't feel supported. They keep borrowing and taking money from other people. They are often in debt, and they're aggressive and assaultive. And finally, this can't be happening during a manic phase or schizophrenia, because then the diagnosis is different if it's happening at a cross section, whereas ASPD is throughout. So it's pervasive. So that is antisocial personality disorder. Moving on to borderline personality disorder. Borderline personality disorder, if you could think of every possible toxic relationship terminology used around, is typically around borderline personality disorder. There are intense mood swings. These people are really unpredictable. There's a constant fear of abandonment. Oh my God, you're going to leave me. Don't leave me. Please don't leave me. Please stay with me. Begging, pleading. An unstable self-image, which would look like either a constantly changing hairstyle, constantly changing residence, constantly changing job, constantly changing partner, constantly changing need and who am I, constant dissatisfaction with one's body image. And impulsivity is a very hallmark trait as well, and this usually leads to unstable relationship. And the mnemonic is I raised a pain, because sadly these people are called pain, and there is identity disturbance, as I said, the self-image part. Relationships are often unstable. They constantly fear abandonment is a clear word. They will say, oh my God, you'll leave me. And whether it is a real abandonment or whether they'll imagine it, they're often impulsive. They'll suddenly do reckless things. Suicidal gestures are very hallmark. They may say that they may have shallow marks on their hand, or they may say that, I'm going to kill myself if you don't talk to me. There's a chronic void or emptiness within. There can be dissociative symptoms, which could look like fainting, amnesia, or losing touch with reality, depersonalization, derealization. In depersonalization, you feel like you are outside and you're observing yourself in third person, and in derealization, you may feel like your surroundings and you are disconnected. That is dissociative symptom. There's affective instability. Their mood keeps on going up and down. They could also feel paranoid in a stress related environment. They could feel that other people don't like me, that my friend doesn't like me, that friend will steal my boyfriend. There's anger which is poorly controlled, so there's a lot of anger outbursts. There's an idealization followed by devaluation. Oh, I love you, I hate you, you're the best, you're the worst, in a split second. Splitting is a defense mechanism here. And negativistic or undermining themselves with self-defeating behavior. They often have self-defeating behavior. I'm not good enough. Next is histrionic personality. Think of every actor that you can, anybody who's very animated. They are attention seeking. They're perceived as one. They are excessively emotional. They feel too many feelings. They constantly need approval from other people. And they are dramatic or exaggerated. Now, movie stars often fall into this, especially when they're very dramatic. And the mnemonic is I crave sin. I is inappropriate behavior. Inappropriate behavior, they could come across as seductive. Why are you wearing this red dress in a mandir, which is really short and you're finding it hard to sit now? Oh, I did not know. The idea is to be the center of attention, good or bad. Relationships are often seen as closer, much closer. Oh, they're really good. That's my best friend. That's my best friend. That's my best friend. None of these people actually are your best friends, and the relationships are seen closer than they really are. For them, the way they look is extremely important, and they feel vulnerable if somebody else condescends them. There's an emotional expression which is exaggerated. I am so depressed instead of saying I'm sad. Oh, I will die instead of, and they may not threaten as much, but they may say I will die rather than saying I'm upset again. There's a shifting emotions from shallow, so they may feel I don't care, doesn't matter. And there's an impressionistic manner of speaking, as in they would just talk very vaguely about things, but not necessarily in depth about any topic, especially even about their feelings. And they constantly crave novelty. They constantly need new. The final cluster is cluster C, in which anxiety is at the center. There's a tendency to be sensitive, a preoccupation with, oh, you're going to criticize me, or there's a preoccupation with being rigid. And the three things are, you can think of ADO, avoidant, anxious avoidant, dependent, and OCPD, which is obsessive compulsive personality disorder, not OCD. Very different from, some may find overlap, but different from OCD. Also called anancastic. There's a difference in DSM and ICD how we categorize. So anancastic and OCPD. Let's talk about the avoidant personality disorder. An avoidant personality disorder person may feel a persistent feeling of inadequacy. They want to avoid pain. They want to avoid rejection. They want to avoid social interaction because they worry that they'll be told, oh, your clothes are not nice, or that, why are you talking like that? Why are you eating like that? So the mnemonic is ridicule. They're constantly feeling ridicule. R is restrained with relationship. They don't end up having relationship. They want to have relationships, but they fear that they will be rejected. This is very different than schizoid and schizotypal. Remember, these people want to have a relationship big time, and they're inhibited in interpersonal situations. They will not tell you they felt upset about something you said. They disapproval is a constant expectation. They think they are not performing well. The boss will hate them. Girlfriend will hate them. Boyfriend will hate them. They feel they are inadequate. Criticism is expected for them, and they are unwilling to get involved. Hey, why don't you take part in this race? No, I don't. Even though they're a good runner, because they are worried about the embarrassment that they may lose, and they constantly long for attachment. This is the biggest difference. The D is the dependent personality disorder. As the name says, very dependent, always relying on others. There's a fear of abandonment here, different than the previous one. In the borderline personality, fear of abandonment, it is almost like pushing you away, whereas in this, it is pulling you closer and saying that, please don't leave me. How will I decide whether I should go for that interview or not? How will I decide whether whether I'll be able to meet that friend or not? So, darn hurt, that's the mnemonic. D's disagreement is difficult to express. I don't agree with you, but if I say that to you, you will go away. Let me not tell you my true feelings. So, avoidance is here, but it is not avoidant personality. It may be seen along with sometimes. advice. Hey, I need your advice. What should I wear? Hey, I need your advice. These people may take forever to shop. The R is for responsibility is always delegated to others. What do you think? Why don't you only decide? No, it's okay. I don't mind. And they constantly need nurturance. It's almost like they are the one cared for, and they are with a caregiver, and they want to be taken care of constantly. They feel helpless when alone. They feel like they will not be able to survive in this world. They have unrealistically been preoccupied with the idea that I'll be alone and I'll die alone, and I'll be left to care for self. The relationships are desperate. Please, please, please don't leave. And the tasks, they have difficulty in picking up new projects because they fear, that they need someone's assistance with it. The OCPD is interestingly somebody who's rigid. There is a preoccupation with orderliness, order. The three P's that we look for are parsimonious, punctual, and perfectionistic. Parsimonious means stingy with money, and they are inflexible. They think my way is the right way. These people will be found at the airport 3 hours or before and coercing their family, saying chalo chalo chalo, let's go, we're late. And the family will say, but this is 4 hours before the flight, we don't need to be there, only 2 hours before. They say, no, if we leave early it'll be better, I'm telling you, this is my experience. They will double check their excels, they will double check everything, not because of OCD. It is a pervasive pattern. So the mnemonic is low mirth. L is leisure activities minimal. They think that it should be work, work, work. They're very good workers. Organizational focus. They're considered good employees, by the way. The W is work and productivity is the main focus. M is miserly spending habits, parsimonious. I is inflexible around morals and values. We have to be on time. They said 8 p.m. We there at 8 p.m. sharp. Why are you late? Why is it already 7:30 at home? We need to be there at 8. They are rigid, they're stubborn, and the task completion sometimes is so slow because they want to do it perfectly that it becomes slow. And they even hoard items. Oh, don't throw that paper, maybe I need that receipt, but this is a 5-year-old receipt, maybe I need it, don't throw it. Their houses may look like a dumping ground sometimes. Now, the causes for personality disorders. Risk factors are some people innately have a temperamental difficulty, whereas certain times it's the child neglect, abuse that can also lead to it. Personality disorders can also be there in parents. Now, interestingly, our personality is made up half from our parents genetically. So, yes, if the mother has borderline personality, the daughter may have histrionic or borderline personality. If the father is ASPD, the son may have traits or of narcissism or similar cluster. Less likely that your parents have different cluster and you are a very, very different cluster. But this is only half. The other half is your own lived experience with the world. Prevalence and onset, a lot of MCQs here. More males have antisocial and narcissistic personality disorder. So again, very simple to remember. More males, narcissistic cluster B may say, antisocial and narcissistic. More females have borderline and histrionic personality. Again, cluster B, females, borderline and histrionic. The personality disorders are usually not diagnosed until late adolescence or early adulthood. That's true. And they are chronic over decades without treatment. Another thing, more men have paranoid personality and cluster A in general, and more women have have dependent personality, but a lot of men and women both can have OCPD and avoidant traits. But it's important to remember these more common ones. Now, the paranoid, schizoid, and narcissistic personality get worse with age without treatment, whereas antisocial and borderline actually mellow down or get better with age. It's important to remember this. Now let's take up some questions. Which personality disorder is characterized by pervasive pattern of disregard for and violation of the right of others? So I told you that who doesn't care about others? Yes, a narcissist also doesn't care, but this is the violation of the right of others, not just lack of empathy. That is antisocial personality disorder. So the answer is C. A 28-year-old Mr. A, history of legal troubles since adolescence, so starting before age 15, exhibits a pattern of disregard for societal norm, no remorse, no guilt, tendency to exploit others for personal gains, manipulation, charming and manipulative, engaging in deceitful behavior, lying. So Mr. A's behavior is most consistent with which personality disorder? Again, antisocial personality disorder, not narcissistic, because not only is there lack of remorse and charm and manipulation, but also there is a legal trouble and the adolescent pact that makes it antisocial, not narcissist. Miss B, 35-year-old, long-standing pattern of unstable relationship, intense fear of abandonment. Number 1, impulsivity. 2, recurrent self-harm behavior, frequent mood swings, affective changes, and distorted self-image. The answer is pretty clear-cut between borderline and histrionic. Which one will you choose? Self-harm is there, impulsivity is there, distorted self-image is there. So, borderline personality. Individuals with schizoid personality are more likely to exhibit what? Dramatic behavior, disregard for norms, detachment, and emotional coldness, or intense fear of abandonment. We discussed that they are socially detached and they come across as cold. A 40-year-old male seeks psychiatric help due to persistent feeling of inadequacy, social inhibition, avoids interpersonal interaction because of fear of criticism or rejection. He desires close relationship, extremely hesitant to initiate them due to the fear of being ridiculed. The word ridiculed, that means that they are basically avoidant. They are avoiding the fear of being ridiculed. And Miss D, of 25-year-old woman, presents with a history of attention-seeking behavior, excessive emotionally, strong need for other people's attention, tends to exaggerate emotion, and feels uncomfortable when she's not the center of attention. We discussed the actress syndrome, which is the histrionic personality disorder. A pervasive pattern of instability in interpersonal relationships, self-image, and affect, along with impulsivity, is characteristic with borderline personality disorder. Excessive emotionality, attention-seeking behavior, histrionic personality. And with that, the demo is over. Thank you very much for your time and attention. My name is Dr. Dutta.